If you've ever walked onto a hospital floor, it can honestly look like absolute chaos, right? Alarms ringing, people rushing around. But behind all that apparent chaos lies a highly structured, almost brilliant scientific problem-solving engine. Welcome to this explainer. Today, we're breaking down the exact methodology that systematically stabilizes patients, treats their evolving conditions, and actually gets them on the road to recovery.
Okay, let's dive into this roadmap. First up, the blueprint of care. Then we'll be mastering the ADPIE framework, followed by looking at medical versus nursing diagnoses. After that, we'll talk about executing smart nursing interventions, and we'll wrap it all up with some real-world patient case files.
Section 1, the blueprint of care, or as I like to call it, organizing the chaos.
To really wrap our heads around this, it helps to think of the nurse less as just a caregiver and more as a medical detective executing a complex scientific method. The absolute core of this blueprint is called the nursing process, or NCP. Basically, it's a systematic problem-solving approach used by nurses to assess patients, identify health problems, plan and implement care, and then evaluate the outcomes. And the thing is, this framework is universally used across all healthcare settings. It's totally dynamic and cyclic, meaning it actually changes as the patient's condition changes, looping over and over until specific health goals are met. This patient-centered blueprint is explicitly designed to provide top-notch care, prevent severe complications, and make absolutely sure there's continuity of care, no matter who happens to be on shift.
Moving right along to Section 2, mastering the ADPI framework, the core blueprint. Okay, so every great medical investigation requires a structured set of steps, right? Let's look at the 5 steps that make up this incredibly easy-to-remember mnemonic, ADPI. That's assessment, diagnosis, planning, implementation, and evaluation. Now, you've got to understand, this isn't just some static paperwork checklist. No way. It is a dynamic, life-saving loop. You assess the situation, you figure out the exact problem, you build a targeted plan, execute that plan with absolute precision, and then, this is key, you immediately evaluate if it actually worked. And if it didn't, well, you loop right back to the start and assess it all again. Now, what's really interesting here is the stark contrast between the 2 types of data collected during that very first phase, the assessment phase. On one hand, you have subjective data. This is the human experience, right? It's what the patient actually tells you. Things like, I have chest pain, or I feel so weak. But the nurse pairs that directly with objective data. This is what can be actually observed and measured, the hard data. We're talking about a fever of 102 degrees, a blood pressure tanking to 90/60, or oxygen saturation plummeting to 85%. You literally need both, the human experience and the hard scientific metrics, to crack the case. Section 3, medical versus nursing diagnoses, the crucial distinction. All right, honestly, understanding this difference is a true aha moment for grasping how a hospital actually functions. Let's look at this comparison. A medical diagnosis identifies the disease itself. The doctor comes in and says, you have pneumonia, or you have a fracture, or diabetes. Simple enough, right? But a nursing diagnosis identifies the specific patient problems that can be treated directly by nursing care. So for that pneumonia, the nurse diagnoses impaired gas exchange. For the fracture, the nurse diagnoses acute pain. Do you see the difference there? The doctor focuses on naming the overarching disease entity while the nurse focuses on the actionable human response to that illness. Essentially, the nurse is treating what the disease is physically doing to the patient in that exact moment. And it is incredibly structured. The format of a nursing diagnosis is basically a mathematical formula. It's problem plus cause plus evidence. Let me give you an example. Impaired gas exchange related to lung infection, as evidenced by an oxygen saturation of 86% and shortness of breath. I mean, this beautifully shows just how evidence-based and precise the nurse's thought process truly is. They aren't just guessing around. They are tying a specific problem to a root cause and backing the whole thing up with undeniable objective evidence. On to Section 4, executing smart nursing interventions theory into practice. So let's transition into the planning and implementation phases. We have the diagnosis, so now the nurse basically sets up a clinical sting operation to combat the patient's illness. The absolute crucial point here is how the goals are actually formulated. They must be SMART, specific, measurable, achievable, realistic, and time-bound. Because rather than just vaguely saying, hey, let's help the patient breathe a little better, the nurse sets a highly precise target. Notice how the target oxygen level is mapped out here. It's specific and measurable. We are aiming to go from a dangerous 86% up to a healthy 95%.
It's achievable and realistic given the medical tools on hand, and super importantly, it's time-bound. We want to see this specific result within 24 hours. And that leads us directly into the final 2 steps of ADPI: implementation and evaluation. Implementation is the action phase. It's where the nurse actually performs the planned interventions, administering the oxygen therapy, giving the right medications, maybe physically positioning the patient in a semi-Fowler's position to really open up those lungs. And then they close the loop with evaluation. Did the patient actually improve? Did that oxygen saturation actually hit 95%? If the SMART goal was achieved, fantastic. If not, the nurse doesn't just wait around. They immediately modify the care plan. It's literally the scientific method in action.
Section 5. Real-world patient case files. Into the field.
Okay, we've got the theory down. Let's deploy this ADPI framework into some high-stakes, real-world clinical scenarios, because these are the actual care plans happening on hospital floors right now. First up, the pneumonia case file. The patient comes in coughing, feverish, and visibly struggling to breathe. The nursing diagnosis? Impaired gas exchange. The goal? Maintain O2 saturation above 95%. And the interventions are rapid and systematic. Administer oxygen immediately, actively encourage deep breathing and coughing to clear out those lungs, give the prescribed antibiotics to fight the underlying infection, and sit the patient up in that semi-Fowler's position to mechanically help the lungs expand. Boom, problem handled systematically. Next, let's look at the diabetes mellitus case file. Here, the patient has high blood sugar, weakness, and is complaining of excessive thirst. The diagnosis is risk for unstable blood glucose. The goal? Keeping that glucose firmly within normal ranges. And this brilliantly illustrates a critical mix of immediate action, like continuously monitoring blood sugar and administering insulin, paired with vital long-term action. Things like educating the patient on a proper diabetic diet, encouraging exercise, and teaching them exactly how to monitor for hypoglycemia at home. All right, let's check out the hypertension case file. A patient presents with dizziness, a severe headache, and sky-high blood pressure. The nursing diagnosis for this one is ineffective tissue perfusion. The overarching goal is to aggressively, but safely, reduce that BP back down to normal limits. So, step by step, the nurse monitors the BP regularly, administers antihypertensive drugs, completely restricts salt intake in the diet, and actively encourages lifestyle modifications and stress reduction. It's a multi-pronged attack to stabilize the patient. Now, the stakes go way up. The myocardial infarction or heart attack case file. The patient comes in with severe chest pain, sweating, and intense anxiety. The diagnosis here? Acute pain related to decreased cardiac blood flow. The goal is to immediately reduce that chest pain, simply because pain literally means the heart muscle is dying. So interventions absolutely must be immediate and life-saving. We're talking continuous ECG monitoring to watch the heart's electrical rhythm, pumping in oxygen to feed the dying heart tissue, administering prescribed cardiac medications, and enforcing strict bed rest to immediately decrease the heart's workload. Finally, let's wrap up these files with chronic kidney disease, or CKD. The patient has edema, that's swelling from fluid buildup, and elevated creatinine levels because their kidneys are actively failing. The diagnosis is excess fluid volume. The goal is to rigorously maintain fluid balance. But how do you do that? Well, through meticulous, ongoing tracking. The nurse strictly monitors literally every ounce of fluid intake and output, takes daily weights to track water retention, restricts fluid intake, and administers specific medications to help the body pull off that dangerous excess fluid. Bringing all these concepts together, we land on this really powerful summary quote from our source material: "The nursing process is the foundation of professional nursing care. It helps nurses provide safe, organized, and patient-centered treatment." Through assessment, diagnosis, planning, implementation, and evaluation, nurses literally bring order to the chaos. It is the essential, undeniable bedrock of quality patient recovery. So I want to leave you with a thought here at the end of this explainer. We've seen exactly how ADPI takes a patient from absolute crisis to stabilization using a highly systematic, evidence-based loop. So if the nursing process is literally the engine driving patient survival, how might understanding this dynamic, problem-solving mindset change the way we actually view these healthcare workers? I think it challenges us to see nurses not just as helpful assistants following doctors' orders, but as master problem solvers, executing a vital scientific method every single day. Thanks so much for joining me on this explainer. Keep learning, keep questioning, and I'll catch you next time.